Good afternoon. Thank you so much for coming. I hope everyone enjoyed a nice lunch. My name is Chris McKenna. I'm the founder of Protect Young Eyes, and I'm looking forward to a lively discussion about the interaction between mental health, which I know all of us feel, whether we're a professional or a parent or other. I'm sure we're feeling that, and its interactions with technology. I'd like to introduce our amazing panel that we have here with us today. Right here immediately on my left is Dr. Stacy Drury. She is a psychiatrist at Boston Children's Hospital. Thank you so much for being here. We have, in my notes here, Kim. Yes, I have you here. Yes, Kim Samuel. You are on the right panel. That's right.
It's okay, we're keeping our panel.
You do belong here.
We can only go up from
They can only, right.
We're going to stand by your side.
She's a leading voice in the global movement for belonging. And I want you to listen to this. In her title, she is the Chief Belonging Officer. I think that's a fabulous thing. We have Larissa, but Lars May here. She is the founder of HalfTheStory, a movement that empowers young people to be a part of this conversation, which is very important. And then we have Dr. Cara Altimus, the Managing Director of BD Squared, which I know you'll explain more about that as we have a conversation here. And then Dr. Mitch, who has been a part of, I believe this is your third in a row.
Yes.
This is excellent. He's the Chief Science Officer at the American Psychological Association and the John Van Setter's Distinguished Professor of Psychology. So thank you. Looking forward to a great discussion. So the title of this conversation is Online Lives, Offline Harms. And I want to start off with a question here because it's important for us to know what is the research telling us, right? We get a lot of tweet-based headlines that say things about the mental health crisis. That's not always the healthiest way to understand what is actually going on. But there are some things that we need to have a conversation about. As sometimes I say to young people, we've even seen superheroes needing to take a break. Tom Holland, right, and others who have played superheroes in movies, they've stepped away from social media because of some of the pressures. So if superheroes need to take a break, we should be listening to that. So I want to start off with a question. What does science tell us about the role technology is playing? Let's get away from some of the hyperbole and talk a little bit more about what the data is telling us. Who would like to start off? Dr. Mitch, go ahead.
I can start with that. I know that there are numerous media reports that suggest that, after X number of minutes on social media, one's brain will explode. And that's not been quite supported by science in exactly that way.
Okay, yeah.
But what we have found is that, so scientists, of course, take an easy question and make them really complicated and nuanced, right? So I'll just say that what we found is that you can really break down the question about social media away from time, how much time is spent, and really instead think about social media as having some constituent parts. The content that kids produce or they're consuming, the features, the like button, the endless scroll, and then the AI. And you also have to think about, for every minute that a child is using social media, what are they not doing that might have been important? So when you look at it that way, there are actually accumulating evidence to suggest there are many, many ways that social media seems to be related to mental health outcomes. Some positive, some suggesting that there are risks, however. The sleep that we are depriving kids of in particular is affecting the size of their brain development and the functionality. We're seeing that the cyber hate that they're exposed to is, of course, very damaging. We're seeing the ways in which it manipulates peer influence and the extent to which, adults and kids are believing more polarized views of one another. I can go on. There are many different areas, but in general, it's really less about the screen time and it's more about understanding which functions for which kids are affecting them in which ways.
Yeah, I think that's so important to look at them individually and not just say X amount for all kids has a predictable outcome and not quite that simple. Anyone like to elaborate on that a little bit?
Well, I was just going to say we have to look at the climate movement and other movements that have come before us.
Yeah.
And I look at screen time as the carbon footprint. And when you look at a carbon footprint, that was actually a term created by publicists to take the onus off of big oil and put it on consumers. Screen time does a lot of the same thing and taking the onus off of big tech and putting it back on the user, and which I also hate that word. It should be consumer or creator. So what would it look like to create features that optimize for more emotional agency? And I think that would help us get to a brighter future.
Yeah, go ahead. Cara, did you have something? And then Stacy.
Yeah, I wanted to add a little bit more color around what do we know scientifically
Yeah,
about
please.
screen time. And one, we have really good evidence around correlation that just essentially, while there are not minutes for head explosion, there is a pretty good indicator that we're seeing increased mental health struggles in young people that have correlated with increased screen time over years and in individuals. So individuals that use screens more and social media more are indeed experiencing they're more prone to mental health issues. When we then dive deeper, and I'll full disclose, I have PhD by training and in the neurosciences, so I can't help but look at this and say, we are an amalgamation of our experiences, and our brain is changed with all experiences put in. And so that what are we doing and exposing our brains to, and what are we not doing and not exposing our brains to, actually strengthens different parts of our brain. And so one thing to just drop in the conversation now is that social media and the like button and the easy access to quick content co-opts the same circuitry in your brain that addiction does, and the use of addictive substances. It also co-opts the same circuitry that that feels good when you make real human connection and work hard at that, but in a much easier way. And so it's a shortcut to some of those reward signals. And so I'm sure this will come up later.
That's
but
right.
I think
And neurologically, the brain it'll prefer that shortcut over time, right? Because it's looking for the quickest possible outcome from some of those desires. Is that?
we like all of the reward
That's
good
right.
signals, so we
Yeah.
don't have to. It's not a, but it's the shortcut to get it.
It is, for
and
sure. Yeah.
And I
Stacy.
would just add that it's the reward system, but it's also attentional mechanisms, right? And so we're teaching short acting, like go there, go there, go there, go there. And then we do this really bizarre thing, which is we completely shift the model when you walk into a classroom. Right. So we have 5-year-olds that are sitting in classrooms listening to teachers like drone on. And really great teachers. We love teachers. Wait, I don't want to say anything bad about teachers who are given instructions to be very rigid, right? And so we've created a complete disconnect between the world outside of the classroom and the world in the classroom. And that's really important when we think about the next generation of our business people, of our leaders, of who is going to be taking on these battles for us. Is that their attentional mechanisms are designed to look at things rapidly.
Correct.
And move on, and not do the deep dive that I think is so important to build the connection.
And then we get upset when they don't figure out how to differentiate between those two environments. Right. But we did that. We did that. So,
Right, and then we don't have a chance to belong because we can't pay attention long enough to get there.
Right.
Yeah.
I just
Go ahead, yeah, please.
I just wanted to add a quick point about data and a quick point about diversity. And the point about data is, and I know that all of you will have lots of data either that you've researched on your own or that you've learned about. And it seems to me that the data is only going to get stronger and stronger, and yet the changes that need to be made aren't being made at the speed or addressing the complexity that's there. So I think that the challenge is how to communicate the data and getting people to listen who are, on the one hand, government political actors, corporations, and on the other hand, which is the hand that I most often hold, which is at the community level, in this case in the school. So that would just be the one on data. And on diversity, I'm using this in the widest sense. I think it's really important in looking at data to be really mindful of each specific case, including country to country. And some of the studies that I've read have indicated that countries that are wealthier on the whole are going to be able to have resources and awareness and attention than others. And even within cities, for example, we know this. The poor areas in a city are going to be the one probably without a library or well-stocked libraries. So I just wanted to bring those two up as well.
No, I think that's helpful. Go ahead, Mitch. Yes.
Can I say something about
Sure.
that? Because you said the word data many times, and that's like ringing a bell, so I'm salivating now, and I can't help
Right, right.
but say something
Triggering.
about it. I'm a
Yeah.
scientist by training. So, I think there are a lot of ways in which people are talking about the data to change this narrative or to attenuate this narrative. So let's talk about that head on for a moment.
Okay.
First of all, we don't have near the amount of data that we need to have to study this issue. And that is perhaps for specific reasons. My own graduate students have been swept up by tech companies, hired at salaries far more lucrative than they will ever make as an academic professor, to not study these topics objectively, but to work and use that information to benefit user experience.
Correct. Yes.
There's also a tremendous amount of data from randomized clinical trials that are being done by tech companies to understand what affects user experience, but those data are done without consent that's appropriate for children. So, when you buy a phone or you log in, it says our privacy notices have changed, and it says, here, read 72 screens about all those changes. Well, most of us for adults say, yeah, fine, accept. But even if you were to look at it, it's not written in a language that children can understand, and to understand the implications of what it means to give up their data. Those data are then opaque. We don't have the opportunity to see those data. So I think that's a concern. And last, I'll just say that we desperately need to do more research on minoritized populations and on communities that are not normally included in research globally. So the fact that what we're finding already is so concerning without the data that we can be getting, I think is a very big important part
Right.
of the conversation that we can all be having but as we leave here, is we have a responsibility to the wellness of children to know what's happening
Right.
by companies who are making profit off of them.
Right.
And I just want to say that the global piece is really important because I cannot presume to know what is beneficial or helpful for a child in Kenya, for a child in Sierra Leone, for a child in a different country and a different culture. And it may be that the connectedness can happen there. And if we just make a broad assumption, we are going to miss really important opportunities to grow and develop healthy children globally. And we don't want to miss that. And we also don't want to say, oh, well, we can just give you this information through social media and you're in a different country or you're in Kenya. That doesn't make any sense if
Right.
what they need to know is about their culture, about their family, about who they are with, so that they can strengthen that tie rather than break it apart.
Yeah. I think. Go ahead, Larissa.
Yeah, I think as we also think about the global piece, the local piece, which you brought up, has really what has opened my eyes the most in this work. At Half the Story, we primarily work with under-resourced urban and rural communities. And we measure and look at the whole student so that we can optimize not just for a little bit less digital addiction or problematic social media use, but so we can optimize for a world where kids will flourish in the digital age. So what does that look like? It's not just what they're doing online. It's looking at them as the whole child in 21 different aspects of how social technologies impact their self-esteem, their character development, their relational health, and also their relationship with the digital world. Well, who is Lars online versus offline, and are those connected? And we need to be not only educating those points, but researching both the points in the digital and the physical worlds
Right.
to create data and climate reports for communities so that we can invest dollars in the right places for more systemic change.
Right. I think that's obviously one of the desired outcomes from human change is to be able to create the kind of opportunities to get that information. I joke with parents all the time that we talk about going online. That's a very old person thing to say, right? Because we see a life offline, an analog version of ourselves, and a life online. And kids don't see it that way. They have an on life that it's intertwined, it's a part of the DNA. And so to truly understand how to help them be healthier, as you're saying, 24 hours, not just the 8 that they're online according to the information upstairs. I think to get our hands on some of that data, what's behind the curtain, we would hope to be able to do that, to make more informed decisions, right?
Yeah, and it's not easy to do. I mean, it takes a lot of work. It takes
does.
buy-in from a lot of stakeholders and also parents. It's a lot easier for tech companies to get data from kids than academics to get data from young people in education systems.
Right,
And
right.
who do we trust more? I would say the academics.
That's right. Yeah, up here.
And I will
Okay,
also,
yeah, go ahead.
Mitch and I had this conversation earlier, that we as academics have not done our due diligence at translating the information into stuff that is able to be utilized and accessed by corporations, by companies. And we have not been loud enough to take on that role where we are saying, I don't want it done in these private, obscure places. I want it done with openness and academic strength and rigor. And I need to be faster at getting that information out.
Yeah,
I am
definitely.
too slow because this is too important and we can't wait.
I'm
Yeah.
just wondering about to what you just said, to allyship in seemingly unlikely places, such as the science and academia and school teachers and students and the parents and the whole holistic school community, as opposed to you're here and not completely, but
Right.
maybe those voices could be amplified because the corporate voices tend to dominate, don't they?
do. Yeah.
And I think that's the magic of what human change is about, right? It is about bringing together all of those voices, recognizing that we cannot do it in silos.
Right.
And if we don't start having those conversations now, we will never get there. And we do need the voices of teachers and parents and kids to be as loud as corporations or nerdy academic folks.
Yeah, we need some of that though. But thank you. I want to bring maybe the discussion down a little more specific for a minute. And Cara, it was you who said something that prompted this thought. Could you help us understand a little bit, and I'm sure others will have feedback on this too, are there developmental windows in the life of a child that are more critical, more sensitive, more vulnerable than others? And how must that be a part of the conversation as we consider technology?
Neurodevelopment goes on and on. We develop our whole lives.
Okay.
And there are unique parts of the brain that are developing in those windows. And the teen years in particular are especially interesting. I joked, the panel knows, my plane landed, I jumped on a train, I jumped on another and another, and walked in, and I'm sitting here, and when asked if I wanted coffee, I said no, because I'm all caffeine and no inhibition right now. And the immediate joke back to me was, oh, you'll be a teenager on stage. And so I use that as the children, particularly in those teen years, are some of our fastest learners.
Right.
They are absolutely absorbing and absorbing and absorbing, but some of the connections that cause some of the impulse control and the inhibition and the rest of it are not there. So it's, full steam, no throttle. And that's why you see increased rates of nicotine addiction, or many substances have increased rates of addictive property in the teen years. And that's what we're looking at when we're looking at social media addiction, is those same principles are happening where you've got no throttle, all action. And if you look at the other thing that's happening then, that being our greatest potential for learning, where you have the greatest, what are you not doing? What are you learning instead?
Right.
And so, I think as we're thinking about this overall, we have to think about kids, young people see social media as connection to the world, as a way to understand, as a way to connect with community. And so I don't think that none of us are saying it's as simple as trash it. It's thinking about what is the balance and how do we drive towards the good? How do we use it well? How do we teach children and families to use it well so we can learn, so that we are driving the right outcomes?
Definitely. Go ahead, Stacy. Yeah.
And I want to switch to the opposite end of the developmental window, at a time when the eye contact, the face-to-face, the social interactions are the scaffolding upon which kids build the ability to have some sort of control of that relationship between the amygdala and the frontal cortex. And that's the early childhood years.
That's right.
Right?
You love babies.
I am baby obsessed, right? I am totally baby obsessed because I think of them as this incredible ball of potential and joy.
That's right.
How many of you have ever seen a baby crying on an airplane?
Oh,
Okay,
Yesterday.
how distressed does that make you? right? You're okay, that guy's not distressed. We got to find out what's going on there, right? And when that baby stops crying, all of you feel a sense of relief. When a parent is interacting with their child and that baby smiles back at them, it is the most powerful emission of dopamine, of neuroepinephrine, of serotonin. And it is a huge driver, because if you were to objectively look at an infant and how they got to the world, there is no reason you would want to care for them. But they are our most powerful drug. And we need to support parents that they don't get that rush unless it's their eye contact. Like, I'm sorry, you're sitting right there. You knew you were in trouble, right? But like, it's the eye contact, it's the social connectedness. And the earlier kids are on social media, the less of that they're going to get. And the less their parents are going to get. So one of the conversations we had was, a lot of people don't want to be parents anymore. And I was like, that's because they missed the drugs. They missed those early interactions, that social connectedness, that belonging, that made you want more of that drug instead of the endless scrolling.
Yeah.
And so we need to support parents to recognize that drug, and we need to have more of that drug, because that's why we're all here in person.
Yeah, no, that's great. I sometimes joke that even mean people smile back at babies. Like there's just something you're biologically drawn to have that exchange. And it fills you both, right? It's teaching them, but it's also filling you. So I think I resonate with that quite a bit. Yeah. Go ahead, Mitch.
I just want to mention one other thing about the adolescent brain, because after that first year of life, the most important time of restructuring, redevelopment, but one of the things that's happening in the adolescent brain, particularly when it comes to the cycle with social media and with devices. So in broad statements, the part of the brain that's being activated when we see a like button or when we get a notification that says you got new followers, that's a relatively primitive area of the brain. It sits below the cerebral cortex, which is more uniquely human in terms of its development. But interestingly, it doesn't just activate that sense of dopamine and oxytocin but it also activates an adjacent center of the brain that's part of the motivational network. In other words, it makes us say, whatever that was, I want more of it. I want to get more of it. It's below the cortex. So what I'm saying is, we don't consciously say, I want more of it. We just feel an instinct, a craving, a drive for it. Now, the part of the brain, the prefrontal cortex, that allows us to stop pursuing every instinct we have, that's the more human, evolved part of the brain that doesn't fully develop until mid-20s or so for most humans. So when you talk to teens, this is why many of them will say, suddenly I reached for the phone, I picked it up, I logged into the app, and I was scrolling before I even realized what I was doing. Because this is happening subcortical. Right, and that's what we're kind of working, to recognize and help people with, is a thing that's so attached to these more primitive regions of the brain that we don't even realize that we're engaging in the behavior. That's how embedded this is.
Yeah, it's almost like it's good that we want them to be curious, but it's been weaponized by that technology because we have an evolutionary call up to that, right? Yeah, go ahead.
I want to
Cara,
add one more thing that's happening
Please.
in this time period.
Yeah.
So we've talked about the brain. Now if we look at epidemiology and ask when severe mental illness onset is beginning, 50% of individuals that will go on to experience severe mental illness in their life are having the initial stages of that in their teen years, and 75% have had that by their early 20s. Wow. And so just to say, this moment that we're talking about, where you've got rapid brain development, supercharged learning, lots of screen usage at the moment, is also where you're seeing the development of severe mental illness across humans.
I want to just throw in one extra number to that, which is in the United States. Does anyone know what the average length of time it is from first mental health symptoms to first contact with a mental health provider?
I know.
You can't answer, that's cheating.
Except you.
You too. No.
Yeah.
Okay, let's have some guesses.
18 months.
Huh?
18 months.
18 months. All right, other guesses?
7 years. 2 years.
7 years, okay. This is like the Price is Right, the absolute. Okay, anyone higher than 7 years? Okay, so it's 8 to 12 years. right? And so we are hitting this developmental window after those circuits have been struggling
Yes.
for almost a decade. And that makes it really hard to unwire them. And I'm going to say, because I have to throw the little kids in here, age of onset of first symptoms when parents finally meet that mental health provider, when did they first notice things going awry? Before the age of 5. So intervene early, often with the family, with the parents. And when that adolescent brain reopens, that plasticity comes back online because of puberty and neuroendocrine changes, jump right in full on.
Yeah.
Can I pair another statistic with your statistics? So,
Only if my statistic is better than yours.
no,
That's right.
So
I knew this would happen with multiple scientists.
I
but
know,
that's
right?
Okay.
Sorry,
That's okay.
but just really briefly. So, 1 out of every 4 young women experiences a major depressive episode by the age of 25. 1 out of every 4. If this was the flu or COVID or anything else, we would have a clinic on every corner,
That's right.
building resilience, helping them, screening, providing treatment.
Yeah.
But it's depression, and frankly, it's women. And in a male-dominated world, this has been untreated, unrecognized. What are we doing instead? During those 8 to 12 years, we're showing them pictures of bodies that have been filtered to look
Right.
more, the male prescribed norm. We are showing them images of parties they haven't been invited to. They're experiencing cyber victimization. We have taken what pre-social media was already epidemic levels of depression for young women, and we've now added tremendous risk factors that they scroll through 24/7.
Right. Right.
And those are the moms.
I wonder just
Yeah,
on the various scientific interventions just now, something is, and going back to your question about are there certain points, and I'm thinking about the span of it's adolescence, really what you're talking about, up till around 25. Yeah. Well, I when I'm teaching, and most of my students in the field around social isolation and connectedness also tend to be women. A lot of them are they come to a class like that because they're experiencing some of the challenges that you're talking about. And I think about all the kids, not necessarily female students, but maybe it correlates, I don't know, that go to college. Now, not everyone goes to college, so I'm focusing on a specific group. And the rhetoric goes something like, you're an adult now, okay, and you haven't lived away from home before, or you've come from another city, country, harder if it's from another country, but you know what? You've got this. And here you are in your dorm room, and first, I usually get them in about their graduating year, but in first year, and you're sitting in your dorm room, and a well-meaning mom may say, I'm really worried about you, and yet you're there, and you don't seem to be going to things, and your roommate is going to all kinds of things, and gosh, there's like 200 things you could join. I can look up online at your college and find these, so why don't you just get out and do it, pick one thing, you've got this. And I imagine for some of those students, that's not a door in the dorm room. It's a brick wall. Have you ever tried to walk through a brick wall? And I think that is a time when young people are really fail. And when you were talking about the span of the years, including for when parents can do something, I mean, it's shocking, not shocking. You know what I mean? It's but again, I think about how does data help to drive policy change, or help to drive to this assumption of you're an adult now? What does that mean? You weren't an adult before, and you're still really young, and things are still developing, and then try to get mental health support on most campuses. And on some of them, we know, although perhaps it's slowly changing, students are told if they have suicide ideation and want to go home, they think, I shouldn't say which university, but they were told to reapply to get back in. And so I think about how, on one way, how obvious these things are, except they get buried in this this kind of useless, at this point, useless rhetoric about you're an adult now, you get in there, and if you can't do it, you failed.
You're an adult, but you can't drink alcohol, and you can't rent a car. So clearly, the insurance companies know a lot more than we do about when
risk.
children become
Sure.
adults. I think what you were saying is such an incredibly important piece. So I live in Boston. So we get 300,000 undergraduates who come into Massachusetts every year. Boston has one of the greatest ratios of child mental health providers to children, and we cannot cope with that influx because 1/3 of them, so that's 100,000 kids, have severe mental illness, right? And so it is this really important preparing kids for this transition, making sure they have the resources, driving accessibility to effective treatment. And it may be that it's not on campus, it's with your previous provider. But if we don't allow care across state lines or across countries, we can't get them the help that they need at that critical transition point.
Yeah, go ahead, Lars.
Yeah,
Yes.
I was just also going to say, we talk a lot about mental health and then physical health. Those two words to me are no different. Health is health is health is health. And this year, Vivek Murthy came out with a report talking a lot about what is the opportunity cost of connecting. It is the lack of human connection and loneliness. Loneliness is killing us, not only emotionally and mentally, but being online and feeling lonely is actually just as dangerous as smoking 15 cigarettes a day. That's not just creating anxiety and depression, but it's also increasing your diabetes, obesity, all of these other health factors. And sometimes I wonder, and I'm just curious from the researchers here, a lot of this happens to come from just the mental health perspective, which a large percentage of the world, even in the United States, you can't use that term because they don't want to put funding for it or they don't believe in it. How do we start talking about this in terms of greater health outcomes that goes beyond just the mind?
So I will say, I say that every day. It's sort of like my mantra, which is, it is an artificial distinction between physical and mental health, right?
There you go.
So have any of you ever been anxious? What happens to you when you're anxious?
Heart rate, blood pressure, right? All that.
You like an answer machine over here.
Oh,
You're
sorry.
good, I know. It's like cheating, right?
I was
So your
feeling
heart
it. I
rate
was
goes, your
anxious.
heart
Yeah,
rate
yeah, I was
goes up,
feeling it,
right? Your hands start to sweat. Mine are sweating right now, right? And so that's physiologic. It starts in your brain. It's going through the vagus nerve. It's controlling your heart rate. That's anxiety. If anybody in here has ever had a panic attack, that is a miserable physical sensation, and you feel like you're dying so much so that we think sometimes it's a heart attack.
Right.
Or not, right? And then if we figure out it's a panic attack, we're like, oh, you're just having a panic attack, leave.
Right.
But if we were to do that, if it were a heart attack, and we were to be like, no, you have to stay because your heart's going to stop, right? So we need to have that language, and we need to force our healthcare coverage to not bifurcate and say, oh, well, your mental health care is over here, and you can get like maybe something someday. But every one of you could get into a clinic for the flu today.
Right.
Well, it's even deeper than that. You know, of course, everyone knows that we're born with the DNA that we have. That doesn't change. But not all of the DNA in our bodies has been turned on. And at the moment of social exclusion, and we've done this even in the research in our lab, we can take blood from somebody, give them a simulated social rejection, and then take blood again. Within 40 minutes, some of the DNA that had been dormant is turned on.
Wow.
And the dormant DNA, and some of it turns off. The upregulated is a pro-inflammation response. Wow. This makes sense maybe 100,000 years ago, right? If you were kicked out of the herd, a woolly mammoth would come and eat your arm, and you would need your blood to clot, and you would need to ward off infection. Interestingly, your viral immunity goes down. Anyone who's been through a pandemic knows if you're not around other people, you don't catch a virus, so you don't need that. Well, what's interesting about this is that not only is this affecting our inflammation response, but that affects the number one killer in the world today, which is inflammatory related diseases. And that also changes the synthesis of serotonin, which affects depression. So in fact, there is no distinction between physical and mental health. We now know that social environmental experiences change the activation of our DNA, which makes us more likely to get inflammatory disease and simultaneously makes us more likely to become depressed. This distinction was made in the 1500s to be able to allow for different kinds of spiritual healers to address mental versus physical health. We are still operating on a system that was created in the 1500s.
Wow, that is powerful. Go ahead.
I'm going to throw in another nerdy DNA piece.
nerdy now.
I know, we're so
Yeah,
nerdy. Okay.
yeah.
So, and this speaks to your no artificial separation, but the connection between obesity, diabetes, hypertension, cardiovascular disease. So we have demonstrated in my lab that exposure to early life adversity, so separation from your caregiver,
Sure.
violence at the level of the neighborhood, at the level of the community, interpersonal violence, actually shortens the shoelace cap or the aglet at the end of your chromosomes, called a telomere. Has anyone heard of a telomere?
Yes.
Okay, thank you. Right? And so telomeres exist in yeast all the way up to humans. They're exactly the same DNA sequence. They're highly evolutionarily conserved. They are also a primary predictor of cell death, right? They are also a huge predictor of cardiovascular disease, obesity, and hypertension. All of the primary killers of adults. And what we see is a shortening of telomeres in children that are exposed to early life adversity, that are exposed to trauma and community violence. And that is driving and is bidirectionally related to mental illness, which is then subsequently leading to obesity, diabetes, cardiovascular disease, and hypertension.
So I want to pick this up and take it one step further. Why is it such a problem? In this room, we're talking about mental health and physical health as though this is 50-50, part and parcel, interconnected. Diabetes and depression, inflammation, and the development of serious mental illness. All of these are scientific links. Those have been shown very well. The issue is we fund our research, particularly, I mean, we can look across many of the major governments that are funding scientific and medical research. If we look at the United States, we have 31 institutes inside of the National Institutes of Health. One of those 31, is focused on mental health. That one has about $1.2 billion out of $40 billion. So if you take that and ask, if we're thinking about this as 50-50, these are all part of the same system contributing to the same disease. Now you see we're giving 2.5% of funding in the US to studying what we're after. And that will contribute to our understanding of diabetes, cardiovascular disease, inflammatory illnesses, COVID. It goes on and on and on. But we are missing that half of all that we're trying to study.
Stacy, go ahead with one more thing.
How
And
much
then,
for kids? What percentage of the NIMH budget is
Yeah,
yeah.
10%?
I doubt it.
Okay. Well, certainly one of our hopes in the Human Change House is to equip all of you to have different conversations. Now we all know that physical and mental health are the same, and we can have conversations with the right people to change some of those mindsets, some of those medieval mindsets in front of, dare I say, godlike technology. We're still funding according to medieval mindsets, whether it's insurance or whatever it is. In that two-sided, it's one. Maybe we can convince more to think that way. So with that, I would love to turn to the audience. We could have, as you can see, a lot of knowledge up here. We have numbers and data for days, but I'm sure there are questions, whether professionally or even personally, as you have this topic on your mind, mental health and its intersection. What would you like to ask?
So on the DNA of the shortening, it leads to a variety of illnesses, but I didn't hear cancer being mentioned.
Well, because cancer is a little bit more complicated. There is an alternative, this is super nerdy, so I apologize. So there is actually an alternative recombination that can happen with telomeres where there's a folding over, and that can lead to an artificial lengthening. And so that lengthening actually predisposes you to different kinds of cancer. So there's like a sweet spot for telomeres that is related to cancer. So some cancers are absolutely related to shortening telomeres. Some are related to lengthening ones. And I can go super out nerd, but I don't think we need to.
That was pretty good. Thank you. Yeah. Nerdy enough. Any other questions? Yes. Would you mind introducing yourself?
My name's Steve Went.
Hi, Steve. Thank you.
CEO of Parallel Consulting. I'm just wondering at a practical level what the page one characteristics might be for the youth mental health crisis, which is a subset of the title of the talk today. what are those characteristics that we're seeing in the youth community that's giving rise to us describing this as a crisis? At a practical, what are the page one characteristics?
We're seeing tremendous increases in what we call the internalizing disorders, things like depression, anxiety, loneliness, cutting, or non-suicidal self-injury, and also suicidality. The rate of suicide has been increasing for many decades. It's really becoming concerning among a variety of different racial and ethnic groups, and in particular among those who identify as sexual or gender minoritized individuals. So it's very, very high and very concerning. We don't have the providers available in most countries to deal with this volume of serious mental illness.
I'm going to add, in my hospital, at Boston Children's Hospital, about 12 months ago, we had 80 children boarding at Boston Children's Hospital, awaiting higher level of care. They were boarding in medical units. They were boarding in emergency rooms. They were stopping important surgeries that needed to happen for other children. And have any of you ever been to an ER? Have any of you ever wanted to spend 2 weeks in an ER without being able to leave a room? And so what we had were kids that were suicidal or who had tried to kill themselves in a box room with a lot of beeping and noises around it without a window, and we had no protocol to take them out to even get them fresh air. So we placed them in a horrible non-therapeutic environment for weeks because we had nowhere else to keep them safe. 1 out of 4 children in the United States thought about killing themselves last year. 1 out of 4 children who are LGBTQ tried to kill themselves. So this is not a joke. This is a public health crisis, and it's international. Like, the numbers are not just the US numbers, it is around the globe. And we have to pay attention to it because that's our generation, that's our next generation. That is who is going to take care of us when we're old, right? And who's going to be our workforce for every single one of your companies moving forward. And we have not enough providers anywhere in the globe. And you have less providers who look like a diverse workforce. So your capacity to build a diverse workforce is going to go down because we won't have those kids, because they won't be here, because they'll be dead. And I say that with, like, it terrifies me. But I lose 12 children a day to suicide in the United States. And that's not okay.
Stacy, yesterday you shared a statistic around a waiting list, I believe. And I mean, do you mind sharing that? I think it's powerful that you have waiting care at Boston Children's.
Yeah, so you think about Boston Children's as this amazing, I mean, that's one of the reasons I operated my entire life, right? So 10 months ago, I was very happy in New Orleans. And I said, oh, I don't ever want to leave. And then now I am at Boston Children's because I don't think there is another way to address this epidemic. So when I started at Boston Children's, I had a 1,200 person wait list for my outpatient psychiatry clinic. And that's Boston Children's. I have 220 mental health faculty that are psychologists, psychiatrists, and social workers. I have mental health embedded in every subspecialty at Boston Children's. And yet I had a 1,200 person wait list. It's at 711. And so it takes over a year and a half for them to get in to see anybody, right? And that's after the 8 years of waiting with symptoms.
Yeah, thank you. Any other questions? Yes.
Yeah.
Hi.
I just want to thank the panel. I think my eyes filled up with tears 3 or 4 times while you were talking. Not had the best teenage years, but I can't imagine going through that right now in social media. Like, the fact that kids make it through high school and get to college is a miracle. Can we talk about the solution? Is there a solution? Is it that health insurance should cover mental health care?
Yes.
Yes.
Like, is that number one? I think every government or NGO or pharmaceutical company could say, you know, we'll put someone in a loss reserve so people who need it can get it. Or is the second solution just that people can take a break? Like, I remember missing school and I just told my mom, I'm sad. I didn't know what to say. I just said, I'm sad. We don't have a vocabulary for it, and in school, I got in trouble with my grades because I missed school. I mean, I got out of it, but I think, I love what you're saying. What's the solution?
I can give you, this is a very complex issue, so unfortunately there's no one solution. but I can give you several things that we do have the science to support doing right now. Why it's not happening is beyond my understanding. One, we only have an acute care model for mental health. Imagine the world with nothing but emergency rooms. No annual checkups, no advising on how to live a healthy lifestyle, just emergency rooms. That's the mental health system in most countries. Now, that mental health system is grossly underfunded. In the United States, $750 are spent to train medical practitioners for every $1 spent for a mental health practitioner. So clearly, there is an overfunding or underfunding, an imbalance. So we have far few mental health care professionals. But if we move beyond the acute care model, I remember someone coming into my kindergarten class to take a half an hour to teach me how to brush my teeth. Worst case scenario, I would have gotten a cavity. Why are we not going into kindergarten classes to teach them emotion regulation skills, mindfulness skills, conflict resolution skills? That is a missed opportunity. We have the science ready today to do that. And when it comes to social media, I think there's a lot that we can do. We just can't let a company or companies designed to make a profit do so at the sacrifice of our children's well-being and children's brains. Right. We just have to say no. We have to, as a community, as parents, as teachers, we are the consumers, and we just have to say that is not okay. We have to demand, whether it's through legislation or our own choices, make it possible to shut off AI, or don't make this possible. You know, they say that you're not allowed to use social media until a certain age. No one's enforcing that. No one. All the content on there is up for an exemption where they can put any content on there, and there's no culpability on the social media companies. We have to say no. Now, it's going to take policy and tech companies a long time to make that change. What do we do tonight? What do we do right now? Too often, and I'm a parent, and my kids are 11 and 13, so I'm right there. We accidentally convey to our kids, well, I don't know why you're on that thing. You know, we didn't have that when I was growing up, and I just think that's ridiculous. Accidentally, we're communicating to our kids, well, any questions you have about that, don't ask me. Because I think it's all silly, and I think it's not important. We probably need to do the opposite. We probably need to say to our kids, if they're on social media, what are you doing on there? What are you seeing on there? What does it mean that someone said that? Why did they like that? Show me, teach me. I want to be the first person you come to when something happens online that is confusing or hurtful or hard. Right. And I want to teach you how to consume this information. Yeah. Or I want to find the parental control button on my phone and shut down yours. And I think that's something, it's not parents' responsibility to fix this, but we can be waiting for a generation until someone else does. So we have to find multiple solutions.
Yeah, definitely.
I want to just highlight one, absolutely, we need to push insurers to cover mental health and physical health equally. Absolutely. And two, we have to address the stigma.
Yeah. Can I just ask one quick question?
I'm going to, Margarita, would you like to offer something here? Okay, yeah, go ahead.
Hi. You asked about solution. We were speaking here on other panels about parents in the schools, just to at least to free our children from digital attachment in the schools. And why it's so complicated? Because so many parents don't want to do it.
Yeah, go ahead.
Because so many parents don't want to do it. And last week I spoke with a responsible psychologist in Switzerland. He's a president of the Society of Psychologists in Switzerland. And he said to me, the situation is completely new. What we just said here, if we would not have this special situation, then it's a good conversation. But we are here about human change because something unusual happens. The amount of children who need this help, it's a completely new story. Mm-hmm. And he said, Switzerland is right now experiencing something which they never had since they started to collect the information, collect the statistics. one child who wants, but parents think at least, they needs help, today is a waiting list 2 years. It's never had in Switzerland like that. And he said, yes, of course, they are going to try to educate more psychologists, but it will not help. It's no time for this. The change is happening so quickly. And this why, being pragmatical, speaking about solutions, he said that he started to think how, because speaking about finding solution with the politics, it takes very many years, and it will be too late for so many children. So he thinks we have to start with parents. We have to start with parents and many parents, they just don't want to speak about it. It's just uncomfortable. So he said we have to push parents. We cannot rely anymore on their parental duty and love. We just have to, and there's so much information for parents who want to know what is going on, but they just don't read, and even if you ask them to read, they don't want to read it. So he said, as I said here already to our experts, his solution was to tell to this, to take this situation only kind of like a health issue, like this he's free from politics, and to inform all parents that there is education, and we are speaking right now about digital, because of course there, even before these troubles, children needed a healthy way of life, you know, attachment and all this we know. But right now the digital, let's say, digital attachment or digital world in their life, it's just kind of killing our children. So we need urgent measures. And he said the parents should be informed. There's a kind of education. They have to make educational, we don't know yet, it's just the beginning. How long? 2 hours, 2 days. But they have to do it first. They have to oblige themselves to continue at home the special way of how to deal with the digital education with children, and they have to prove it. And if they don't prove it, they already warned there will be no help for their children. And of course, if the child is a suicide, yes.
Right.
But if not, don't. And with the hope that the parents will wake up. Because right now, they kind of want to live the comfortable life. And if my child is in trouble, I will just go to a psychologist. He said, this in ideal world maybe would be possible. But today, in Switzerland, it's impossible. And this is his kind of proposal to use now parents to push them in this very unusual and tragic situation to know if they don't want, if they don't do this, their children will have no help. It is a very, very unusual, very kind of hard measures. But maybe when I was listening to him, I was surprised. But then I said to myself, okay, because we are speaking about solution. What kind of real pragmatical solution what we can do today? I compare it to myself with a belt in the car. This is the responsibility of the parents to do it. And if they don't do it, there are consequences. The insurance are not paying. And not only this, of course, it's a criminal even charge if you don't take care of your children. Maybe we should look at like that. Maybe we should create something, because it is in reality, we will hope for the help from the society, from politicians in many years. But right now, we have only parents.
Yeah. In other words, you've attached, in those other illustrations that you gave, Margarita, whether it's with insurance, there's a consequence to the parent that changes their behavior.
Yeah.
In this case, the consequence being you're not going to get the care you need unless as a parent you're sharing the responsibility of doing certain things. The idea maybe to change some behavior.
For me, it's even very difficult to say something like that. It looks so unhuman.
I know. You want to care for all of them.
I don't know. Until now, I didn't hear anywhere pragmatical solution, really, which is kind of has that we can do it realistically. Yeah. Everything else is our hope.
Thank you. Any other questions? Yes, we'll go to you. Yes.
I'm not sure. Oh, okay.
Yeah,
yes,
go ahead,
okay.
please. Yes,
I was
first.
just wondering, are there any countries who are ahead of this? Are they front runners in this? I know the U.S. is particularly difficult when it comes to insurance and mental health
Sure.
issues. But
Yeah.
any?
Anybody aware?
Yeah, the UK is ahead of us on a
Usually.
few different things here. So first of all, they have a minister of loneliness. They actually have a focus on mental health. They've been importing American psychologists who developed evidence-based therapies to Great Britain to teach all of their therapists how to do the evidence-based treatments that we developed. No one in America is asking us to teach American therapists how to do that, but in the UK they are, and so the royalty there has also helped to destigmatize those issues. But also in social media, the UK has passed age-informed design to make sure that the way in which social media is presented to children is age-appropriate, given the changing and developing brain.
Right.
So France has done a little bit of that as well, and some of the other OECD countries are talking about that too. So we're a bit behind. A very sad statistic about America is that we are tied for number one in the most suicide attempts of any developed country in the world. So this is an area where America is doing pretty poorly.
I want to say that there's also Norway. Another important fact is 50% of children who are born to a parent who has severe mental illness will develop a severe mental illness. Like if that were the case, if we knew that for diabetes, like we would be screening for glucose like every hour in kids, right? We do nothing. We don't even do anticipatory guidance. Norway started a couple years ago an intervention called Child Talk that was basically teaching parents and children when they started to be 8, 9, and 10 how to talk about mental illness in preparation for the fact that their kids were at substantially increased risk. Now, we don't have long-term data on that yet, but like that's an early preventative thing that can be started now, that needs to be started now, that will also feed forward into decreasing stigma.
Yeah.
I'd like to just add that some of these solutions that are coming along are ones that may not sound pragmatic at the outset, but they work. One example of actually a fellow who I met here at the World Economic Forum some years ago, thank you for that, Dixon Shabanda, and he's a psychiatrist from Zimbabwe, and he had noted, as you have noted, so many of his young patients were dying by suicide, and he wasn't able to get to them or even have anyone else get to them in a country where there's still about one psychiatrist for every 1 million people. So he identified a greatly untapped workforce, grandmothers, and he used protocols that were already really effective for going in, and you literally would sit on a bench, and depression is not called depression. I'm going to mess up the word. So to say it's called thinking too much. So the stigma comes out of it, and each of the lay people, mostly grandmothers, he says that men are too prescriptive. They want to give you the solution, but
I like this guy already.
yeah, right. Thought that might catch on here, but anyway, and it's a lot of it is that the listening, and they could do so many sessions, and that part is prescribed, and then the person on the bench might go on to other care, hopefully, or not. And every one who goes into this program as someone on the bench, and the grandmother are immediately part of a circle, and that circle meets maybe, depending on where they are, every couple of weeks, or maybe, but it's not optional. You're part of a circle. And what I love about this is that while you are on the bench or in treatment or come through or gone on for a lot of other care, your your being, your belonging, your experience is valued, and the community gets together on maybe a bunch of benches or sitting in a village, wherever it goes, and decides what problem they want to solve and go at it. And that, it's called the Friendship Bench, and that's in, as you know, a lot of countries. And just in closing, I want to say, as important as it is critical that insurance covers this, we also must really focus on the uninsured, of which there are millions upon millions upon millions, and to say that that's I think our responsibility as parents, as educators, of all the many hats that we wear. That's our responsibility too.
Good, thank you. I am going to pause us there, but please note, first, let's give our panel a round of applause. They did excellent. Yeah, well done. And I know there are other questions. There's certainly an opportunity to come up and bombard them with any hard question that you have. That's why they're here. But when I go back to the title, Online Lives, Offline Harms, I think if there's one theme that has been abundantly clear, is that there's a connection between the two. And let's look for ways to help our kids in both of those places, right? Instead of just experimenting with technology on our children, why don't we experiment with some solutions? Maybe the research can catch up to go, yeah, that was a good idea, but let's try some good ideas first to help as many of them as possible. So thank you so much for being here. Please enjoy hanging out and talking. Enjoy the rest of your afternoon.